important topic when transitioning your pet from puppyhood to adulthood is getting them comfortable with at-home dental care. By 2 years of age, 80% of dogs are affected by dental disease and 70% of cats. So it's important that you get comfortable yourself with different at-home dental care options, but that your pet allows you to do some of these as well. To start, brushing their teeth is of course the best thing that you can do, and doing it once a day is very important. Different options that you have for brushing teeth. One would be here, so a toothbrush similar to what you see with people but of canine and feline design. It has two different edges depending on the size of the teeth that you are trying to clean and the size of the mouth of your pet. With those we have two different kinds of toothpaste that you can use. So here we have the seafood flavor and we also have a beef flavor option. So both are supported by the Veterinary Oral Health Council, and it's kind of a choose your own adventure depending on what your pet prefers, either beef or seafood. If they don't allow you to use the toothbrush, because sometimes that can be a little invasive and scary for them, especially for our puppies, what works really well are these finger toothbrushes. So that's a good option too. You just slip it on the end of your finger, and then you can start with massaging their gum line so it feels nice to them, especially as a puppy who's probably losing their teeth, has a lot of inflammation and discomfort. And then you can graduate to actually touching the teeth and going over each of the teeth. If you're doing puppies, I would caution you to not brush too hard on the teeth. It's really getting them comfortable with the sensation. And then once their adult teeth come in, you can actually do an appropriate brushing motion. Again, trying to do it at least once a day is very important. Pets can, even after a dental cleaning, within 24 hours start building up dental calculus. And if you're not doing any at-home dental care, within 1 week, 70% of pets will already have some gingivitis present. And by 3 weeks, all pets are seen to have some gingivitis present. And that's just because dental calculus builds up quickly on the teeth and then causes irritation to the gums. Think about if we didn't brush our teeth every day, we'd be seeing the same kind of thing. The reason that we're emphasizing this, especially during this time period, transition time period, is that periodontal disease is one of the most underdiagnosed or recognized diseases by both clients and veterinarians. The reason being, it's almost known as the silent killer. So the pets can be affected or their teeth can just be getting worse, but they're not, eating abnormally, dropping food, losing weight, things like that, which is what we see when they have significant disease. So it's important to stay on top of your at-home dental care. Now, I understand that some pets aren't going to let you brush their teeth, so there is fluoride that's safe to add to the water. Again, you want it to have that Veterinary Oral Health Council seal of approval so that it isn't toxic or anything like that for your pet. There's also the dental chews that you can offer, so like Dentastix, most people have heard of. You just want to be careful because they are high in fat, so they can easily put on weight when you start using these products. Again, dental hygiene is very important. Diseases that we worry about that can go undiagnosed or can happen if you're not prioritizing dental care at home would be oronasal fistulas, fracture of the teeth or mandible or maxilla, different kinds of oral cancers, ocular issues, even blindness can happen secondary to oral infection or dental disease, and finally bone infection, also known as osteomyelitis. There are some systemic conditions that they have seen in research done on humans. So renal, which would be kidney, and then hepatic, which is liver disease, can be associated with bad oral hygiene. Also diabetes, heart murmurs, heart infections, all of those things can happen secondary to dental disease. So it's important to, one, be comfortable at home, you doing those procedures, but then also get your pet comfortable with you doing everything that you can to let them live a long, happy life. And if we're at the point that maybe they already have built up a bunch of dental debris, maybe a 3, 4, 5-year-old pet, we always can schedule a dental cleaning to be done under anesthesia here at the hospital. As always, if you have any questions, feel free to give us a call or chat with us about it at your next appointment. But I hope this helps with your at-home dental care.